Lifestyle diseases is an everyday term we typically use to refer to the common health conditions associated with certain behaviors in everyday life. Typically, we usually use this term to refer to hypertension, diabetes, and high cholesterol, as well as the complications that often arise from those conditions. The common lifestyle diseases include hypertension, diabetes, dyslipidemia, which is high cholesterol levels, obesity, conditions like obstructive lung disease from smoking. The thing that makes lifestyle diseases different from the others is that they are modifiable through our behavior. For the vast majority of lifestyle diseases, you can mitigate, prevent, or slow down these conditions through making important, small to major changes in your everyday patterns, and these can improve your outcomes and health trajectory. The people most at risk are people who generally have what we would often look at as an unhealthy lifestyle. So first of all, anybody can be at risk, but the more unhealthy your lifestyle is, the more your risk goes up. People who do not exercise, who are more sedentary, if you do less than 3 hours of exercise in a week, if you have very low sleep quality, people who sleep less than 6 hours, if you have a very unhealthy diet that is low in fiber, that is high in processed sugars and processed meats, you are more likely to develop these conditions. If you are a smoker, your risk is also further increased, as well as for some of them, those who have a family history. If you have a genetic first-degree relative who has high blood pressure or diabetes or high cholesterol, your risk is also increased. Lifestyle diseases do have a genetic component. For the vast majority of people, you are born already with some degree of risk that is predetermined from your genetics. But for these genetics to manifest into disease, your lifestyle then becomes a key factor. So you could be born to a father or mother who have high blood pressure, but if you are someone who has a very active lifestyle, very good diet, you can delay or prevent yourself from developing these conditions. If, however, your lifestyle is unhealthy, you are more likely to develop these conditions even faster and earlier in life.